Hi everyone. Today I'm going to be speaking with you about starting up on a systematic or scoping review. At this point, you might be asking yourself, what did I sign up for? I've actually never worked on a systematic or scoping review. What does it entail? Well, in reality, both are really just very extensive reviews of an existing published topic. And in fact, systematic reviews have been well known in the literature and published for years and years, but scoping reviews have just been gaining in popularity in the last 5 to less than 10 years. In fact, if you look at the number of publications in Medline alone, there's over 20,000 systematic reviews published in 2019, but just over 1,000 for scoping reviews. Now, what are the main differences between these two? Really, a systematic review is meant to answer a very specific, very precise question and can often lead to a meta-analysis if there's quantitative data to process. Scoping review is really just looking at the landscape and seeing what's out there, identifying some potential gap in the evidence, and is often a stepping stone to a systematic review. In both cases, protocols are usually required. In some cases, scoping reviews only recommended, though. In terms of the appraisal process for systematic review, it is very stringent, very critical, and the methodology is well assessed, whereas a scoping review is often qualitative, but again, not always required. In terms of the limitations for searches, for a systematic review, we generally try to keep it as unbiased as possible. So there's no year limitation. You're looking at all languages. You really need a reason to choose any type of limitation, whether it's by age group or, as I said, year. In a scoping review, you're more than welcome, and oftentimes we look at only the last 5 years and choosing a language that you are comfortable with, whether it's English, French, or both. But you don't necessarily have to be as extensive because it is, as I said, just the first part, a stepping stone into looking at the literature and what's missing. In both cases, however, the search should be reproducible. You want to be able to come back to it in 6 months or a year or 2 years later and be able to carry out the exact same search and know that it was well done. The biggest difference, I would say, in terms of screening for a systematic versus a scoping review is when you're looking at identifying the literature and all the references, you really need 2 people to look at the references for a systematic review. And again, this is to eliminate bias. Whereas a scoping review, because you're just looking at a very broad search, you could just use one person. So why am I doing this? Really, it's often just to answer a specific question. For a scoping review, again, it's filling in a knowledge gap. In all cases, ultimately, it's to really help improve patient care. And as I mentioned, oftentimes these reviews are used as a stepping stone to further studies, possibly to a clinical trial, or if you notice that there is not good data out there, again, it's a reason to run, whether it's a prospective study, a more extensive search, whatever it may be, to fill the need. When you start up on a systematic review, a scoping review, in fact, any project, it's very important to define your roles at the beginning of the project. Clarify who is doing what at each step of the way, especially if you're multiple people. Sometimes you don't know if you should both be screening, you don't know who will be writing the main body of the material, who's going to be doing presentations, posters, all that. Again, it's very important to discuss authorship and be transparent at all steps. Be very flexible as well, because things happen in life. Things can change on a day-to-day basis, whether it's with coursework or personal experiences in your life, just be responsible and communicate with the team and be accountable for all you do. Where do you carry out a systematic review and a scoping review? The nice thing about this is really you just need access. You can do this from anywhere in the world, and it makes it a very nice potential for international collaborations because you could have people from all over the world working on one systematic review together. So how do I get started? Really, the first step is to set up that meeting and discuss with the team more brainstorming. What could we do better? How could we analyze this? Once you have all your ideas set out, you're basically ready to write up your protocol. And this protocol should, again, be approved by the team. Once that's ready, you could discuss with the librarian about the search, come up with a work plan, and again, always look at timelines. Once you get your results back from the librarian, you're ready to screen the material. Look at all the references. Again, for systematic review, 2 people. For a scoping, you just need 1. Once you've done all of that, the next major step is looking at data and how to analyze it further. And then the final portion is your manuscript and writing up. Now, throughout this process, obviously, there's lots of going back and forth with meetings and other variations. But the other thing that you should keep in mind, and again, this is really a good opportunity for you to look at conferences, presentations, potential poster sessions, grant applications, anything that could help you, help the team, and help improve the care. But all of this should be looked at as a potential networking opportunity and helping you build your portfolio as well. Now, in terms of time, again, be very realistic. Set what you know. For example, if you don't have classes during the summer and you know that you could dedicate 1 or 2 months to a systematic review, you'll get a lot more done in that time frame than if you do it during the course work. If you are on a clinical rotation, you may have less time. Again, just be accountable for yourself. If you need help, ask for it. We can usually find other people to help as well. So in terms of the time, how long are we looking at for writing up a systematic or scoping review? In reality, it really depends on you. It could take very little time, or often it goes to more than a year, depending on all the steps, on the commitment that you have, the availability of the team, and the complexity of the project. It's variable, but again, just be realistic so that you know ahead of time. So now let's look at some of the practical aspects of it. One of the first things that you should be doing when you're looking at a systematic or scoping review or any review is check in the literature. Is it already published? If you need help, ask a librarian if you're not sure whether it is already published. Now, if you find something that was published that's very similar but it's 10 years old, well, maybe it is time to update that. If it is 1-year-old but very poor quality, then you have justification for running that publication again. So it's all a matter of discussion and looking to see what's available. But if you know it's not published or you've agreed upon working on this, then like I said earlier, it's time to write up your protocol, have it approved, and registering on Prospero. Now, Prospero is a review, a database of systematic reviews, and it essentially gives you a placeholder and lets people know that you're working on this. We've started using it for scoping reviews as well, even though it says systematic, but the processes are so similar that we think that it is good practice to register there. The next step would be to discuss the search with the librarian and work on the search work plan as well together. Now, while you're waiting for the librarian to run the search, there's a lot that you could do in the background. You could do your own research, start reading articles, become the expert in what you're going to be writing about. You could also look at writing abstracts, writing a potential introduction or background, knowing that there may be some room to change once you've completed your analysis. Look at opportunities. Where could you present? Which poster sessions, whether it's a local event at the university, an online event, or something more international. And think about where you want to publish, because every journal publication wants you to submit something slightly different. So it's good to know before you even begin writing your manuscript. So let me tell you a little bit about the search. Who conducts the search? If you look at the standards for systematic review, it's really by the Institute of Medicine. They basically say you should be working with a librarian or someone who is specialized or trained in working with systematic reviews. It is not as straightforward as a Google search for these, and oftentimes there's a lot of detail that you could miss if you don't work with a librarian. So here we all know that, so that isn't a problem for us. Now, just so that you're aware, the librarian is the one who should be writing your search methodology as well as the appendix. And then something to keep in mind is that if the search is over a year old, like 6 months, depending on the topic, you may want to have the librarian rerun the search before you publish. Now, systematic reviews and even scoping reviews, but really systematic reviews are all about eliminating bias. You don't want to introduce bias. We have things from all over the world available. Databases like Medline, which is equivalent to PubMed. Embase has a lot more European coverage, as well as more of a pharmaceutical kick to it. We all know Cochrane. Web of Science is more multidisciplinary, but then we have things that are less common, like Africa-wide information, which is extremely valuable for us. There's a lot of journals in that database that are not indexed and can't be found in our traditional Medline or Embase. And then a really nice addition recently that has many, many international databases is Global Index Medicus, which has been put together by the World Health Organization. So it has LILACs, which is the Latin American database, but it also includes some Eastern Mediterranean, Southeast Asia, Western Pacific, and many other databases that we don't encounter. In terms of a systematic review, we always say you need a minimum of 3, but in reality, especially for global projects and for better quality searches, you basically want to have as many databases as are relevant. So you could have 5, 6, 7, depending on the search. And again, looking at limitations. Do you want to limit by age group? Do you want to limit the last few years or language? For a scoping review, that is fine. For systematic reviews, you really need to have a good reason. Whether it's a drug was only developed in, for example, 2010, then you could start searching in 2010. But if you don't have a good reason, you shouldn't be doing that. In terms of language, you might be asking, well, what happens when you search all languages, but I don't speak the language, I don't understand the language? In reality, most abstracts are available in English, and chances are you'll only have a few out of your full inclusion criteria that will be other languages, if any. So the best practice for that is to find someone who speaks the language once you've limited it, if you feel like something is of good quality, and then basically have it translated otherwise. Again, it all depends on the importance and availability of your resources. Now, in terms of the search, what are your expectations versus reality? I often have students thinking, oh, a systematic review, I could review 100 records. In reality, if you're doing a good quality systematic review, you're looking at many, many thousands. We've had some up to 20,000, but overall we're looking at 3 to 5, 6,000. Don't worry, because it only takes about the average of 2 abstracts per minute to screen. And again, just process the timeline, look at your availability, see whether you want to work on everything in 1 week, or if you want to screen over 30 minutes a day, for example. Whatever it is, you just have to plan ahead and discuss ahead. When I provide you with the results, you will be getting it in EndNote as per the university. But I've also started using Rayyan, and I'll show you that a little bit later. And Rayyan's an online tool that is freely available. And I'm also going to take this time to mention a very nice citation manager. It's called PaperPile. It's available online. There is a monthly minimal cost of about $3 per month, but again, it is very handy and easily usable. So now we're ready to screen. You have the results. Again, EndNote is available from the university or another reference manager, but we really have been recommending Rayyan as it is easy to collaborate with people from all over the world, freely available, and it's online, so you could do it from anywhere. You need 2 people for screening a systematic review, and often a third arbitrator who may be your supervisor. Now, at all steps, keep in mind the numbers for PRISMA. I'm going to talk to you about PRISMA a little bit as well. But some very basics for screening is decide ahead about inclusion and exclusion criteria. You don't want to be halfway through looking at your references and realize that your partner has interpreted something completely differently. For example, you may think that a particular country is LMIC if that's one of your criteria, and in fact, when you look at the table, it is not. Again, go through this, do a trial run, 50 to 100 records with your partner, and then you'll know that you're on the same page. It'll give you some idea as to whether you need to go back to the team and discuss. And it's good to have your data abstraction sheet in front of you as well. As I mentioned, it's about 2 references per minute, but that's if you're really looking at the abstract. It goes even faster on Rayyan if you're just doing a first title screen. Often it's good to look at the titles and know right away, these are not relevant, so exclude them quickly and then go back to finish the rest. So the first screen, I'm often asked this question, you both, for a systematic review, have to independently screen. Neither of you knows what the other is doing, and it's really only based on looking at the title or abstract. It's not the time to start looking up your full text yet. When you're ready to go through the full text, that's your next step. You really go through it, you narrow down, and at this point it's very important for your PRISMA numbers to keep track of the reasons you're excluding. Is it normal to start with, for example, 8,000, 9,000 references, but you're only including 20 or 30 references for your final paper? It's very normal, and sometimes it's even fewer than that. Really, the point of a systematic review is to be systematic, to be thorough, and look through everything that's available for that topic, and know that you did a good job and found everything that you would think is relevant for this topic. In fact, often the higher numbers mean that you've really scoured through and you could rely on this paper to be a good quality publication. Now, when you've narrowed down to your last included numbers, you're looking at the paper very carefully, but because the search cannot be all-encompassing, you can't possibly look through 100,000 results for some topics. What's important to do is to snowball, to look at the reference list for all the included articles, to look at your citation list as well for some of those articles. A good tool for looking at the citations and how those articles have been cited is Web of Science. But at this point, you should be ready to fill in your PRISMA numbers and go through the checklist. And I'll step you through that in a minute. And then you're also ready to start your data abstraction. So PRISMA is really the standard that we use. A lot of journals are starting to require the checklist to be submitted as well. So it is good practice, especially at the beginning of the phase, to look through the checklist that's available online and ensure that you have everything that's required. Although at the time of submission, you may not always need to include this. What is always needed for a systematic review, as well as a scoping review, is the flow diagram. And I'm going to walk you through each step of this because, again, I often receive a lot of questions about this. So this is what your flow diagram looks like. Always remember to cite it. It's actually available, the citation is at the bottom of the sheet as well. So records identified through database searching is really provided by the librarian. It's the number included of all the databases searched. Additional records identified through other sources. You do need to look through what they call the gray literature online. So you could be looking at conferences for this, you could be looking at Google Scholar or just Google to see what unpublished material is available. You would put in whether it's 2, 3, 10 potential sources that you found. Records after duplicates have been removed is really the number of records that the librarian has provided you once he's gone through the EndNote library and removed duplicates or whatever reference manager you're using. But in addition to that, this is also the number found in the gray literature. So it would be the addition of the 2 above boxes. The number of records screened is really all the records in the previous box. You should be screening through all of those, and this is where you're doing the title and abstract screen. The number of excluded are, again, based only on title abstract screen. And the next step is really what's been screened minus what you've excluded. So these are the ones you're doing the full text review, the full text assessment for. So at this point, again, very crucial to keep this list, and it's often submitted separately for publication. Why have you excluded these full text articles? Now, the reasons don't need to be extremely detailed, but you could say, well, it was, after all, an animal study, or it was the incorrect disease, something we were not interested in. So you could usually have 4, 5, 6 different categories for exclusion, wrong age group. It doesn't have to be very extensive, but you do need to keep that reason and list it. And then finally, you have the final 2 boxes. Both are what you've included, but the top one is for qualitative and the bottom is quantitative. So some studies have no quantitative data to analyze, but in some others, you generally have more qualitative. So you could potentially have the top box filled in and not the bottom. Now let's look through some very basics of Rayyan. This is a tool, as I mentioned, that we really recommend for screening. It's very nice, very easy to use, and in fact, because of this, I'm not going to spend too much time on it. It is very straightforward once you have a look. But the first thing is to accept the Rayyan email inviting you to join. So whoever set this up, whether it's myself or someone else, will invite you to join this review. You'll see in the screenshot here that you would have to go, in that case, to your collaboration reviews. You would see it listed and you would begin. So the first steps, one person needs to do this, and it applies to everybody, is to resolve duplicates. You'll see sometimes, even though the duplicates have been removed in EndNote, Rayyan does see many things as duplicates because, for example, a title could be the same, but one is a conference and one is the actual publication, or there could potentially be a very slight difference between the two. Just be careful not to automatically click on remove the duplicate or it is a duplicate. Just have a look to make sure they're actually duplicates before you continue with that step. And then the next very important step, which may take you 10, 15 minutes at most, is to really select the keywords that you want for inclusion and exclusion. Again, this applies to all, and you could see here that my included keywords are highlighted in green in my abstract, and the excluded ones are in red. The reason this is so crucial and so helpful is it makes it visually so much faster to screen through the results. Again, that little extra time at the beginning can save you a lot of time when you're screening through potentially thousands of records. So you could see that here. Green means good and red means not required. So more green you have, the quicker it is to screen through. And all you have to do is click on add new for putting in your keywords and add new for putting in keywords for exclusion as well. As I mentioned, for systematic review, you need 2 independent screeners. You would have to decide whether to include, exclude. There's also a maybe label based on the title or abstract, and we often say it's obvious when it's an exclude. But sometimes you're not sure. Rather than spending too much time on it, add it to your maybe and then move on. And then finally, add reasons and labels. For example, if you have a maybe, but you know you don't really want to include it in your final analysis, but it would be a really interesting topic to include as your background material, put it in as a reason or a label. Put it in, if you have an exclusion reason, you could add that as well. But you don't need to do that at the first step. And as you can see, when on the left-hand side, you'll see that here I have in my undecided pile 1,269. But on the right-hand side, this is after I've gone through. So as you're including and excluding, that undecided number goes down. So whenever you log back in and you go into Rayyan, all you have to do is click on the undecided and you'll see what you have left to do. Now, at the start, by default, Rayyan has something that is called blinded mode. And that really means that you can only see your own decision. And only the person who invited you, who created this file, is allowed to turn it off. So once you've completed your screening, and you have both done so, we could unblind you, and then you could both see what each of you has done. At this point, when you see what each of you have done, you'll be ready to resolve your conflicts. And you could see from this screen, for this particular review, there's only 11 conflicts. You would click on the conflicts and you would have time for a meeting and discuss together what the conflicts are, why you've disagreed, and come to a resolution. If 2 people cannot resolve it on their own, then they ask the third arbitrator, for example, your supervisor. And then finally, once everything is resolved, you have everything set up, it's always good practice to export to EndNote or another reference file as a backup, and it'll be your next step for obtaining your full text or for your citations when it comes to writing up the manuscript. Now, in terms of data, your screening's done, you're ready for full text review, you're ready for data abstraction. Go through once again and review that table. Make sure you have everything you need before you start pulling out all the pieces. Think about the PRISMA numbers, write up the reasons for exclusion for everywhere, and know that only one person is required to do the data abstraction for the full text. So you could divide and conquer. You could have one person reviewing half of the full text and the other person reviewing the other half. The two screeners are really to decide upon what needs to be included. Now, there are a lot of tools out there available. Again, point of systematic review is to reduce the risk of bias as much as possible. So there are a lot of tools to help you go through each of those studies, and it really depends on the type, whether it's qualitative or quantitative, but you do have to use a standardized method and discuss it with your team. But I've listed some examples here. Again, we won't get into it, but they are available here. And there are more than what I've just presented. Another really interesting point is data visualization. There are so many tools and so many opportunities now for us to have really nice visualization. Whether you're looking at hotspots or geomapping, we've used, for example, a data wrapper. There could be others available as well. And we've recently discovered VOS Viewer, again, another very, very nice tool for presenting your data and doing so in an effective manner. In terms of statistics, people often ask me, what do we use? And really, you could use whatever platform you're comfortable with, but in recent years, mostly everyone has been using R. And just remember, if you need help, if you're not strong in statistics, just go ahead and ask, and we'll try to find help for you. Thank you very much. I hope this was helpful for you. You know how to reach me if you have any questions or need any further information. I think now you'll be ready to begin your systematic review or scoping review.